Yeah, that felt fantastic. I needed that one.
Great. Oh man.
That was awesome.
That was that spot.
Yeah, I would say so.
NeuAbility is the business next to me that works with a lot of serious spinal cord injuries, stroke, and other forms of paralysis. And I work with a lot of their patients, but today I'll be working with one of their trainers who hurt his back during a transferring a patient from a wheelchair to a table. Basically, you were lifting and twisting at the same time.
Yep.
And you're feeling stuff kind of in the mid to upper back.
Yep, right in that. Yep, exactly.
Okay. And is that more so on that left side that you're talking about?
Yep, left side the pain was coming from. I was probably maybe about 4 or 5 last night. Took Advil, reduced. Woke up this morning, felt pretty good.
Okay.
Did a transfer again today. Kind of started to kind of linger again. So I was
Okay.
like, maybe I should nip it in the bud as well I can.
Run down and touch the toes while you do that, and then work down the back. Awesome. And no pain with that. Let's go ahead and slowly come on up. As you come on up, that feels okay.
As soon as I were to transfer a person, that's when I get that twisting motion as I'm starting to stand.
Okay.
But it's probably a technique thing, I would think, to some degree or another.
Are you doing the transfers kind of how you showed me with kind of the
Yeah, I
knees?
kind of gotten a little lackadaisical with them as of
Yeah.
recently, unfortunately, too. But
And that's always kind of when that stuff happens.
Yeah,
is
exactly.
I forget. So I'm going to check out some hip stuff. If I bring in the hip here, you pain, pinching, or tightness with that?
pinching anterior side of my hip flexor right here, which is similar to what I get when I squat too.
Okay.
But I drive my hip flexors forward when I do those though.
Hey-o.
Hey-o.
All right. I'll give you some more space on here. Let's go ahead and flip over onto your belly.
Sure.
Do you feel there's more tension on that left side?
It feels pretty even.
Okay.
I'd take the left side.
And you said you're feeling it pretty centralized.
Yeah, so it's right in that thumb area, your right thumb, right? Yep, right up in those guys, those paraspinal, or at least that left side more so.
Okay. And where do you feel the pain the most? Is it tender to touch or?
It's more so tender to move. It's positional, so when I'm sitting, it hurts a little bit more than when I'm standing.
Okay. And how long does it take to kick in?
I don't know, maybe 10, 15 minutes or so. I'm
Okay.
usually up and about quite a bit when I'm here. But
Okay.
it's more so when I was at home last night that it was hurting on me.
Okay. And then if you go ahead and bring both your hands right here, and go ahead and do a push-up, but keep this on the ground. That feels pretty good. You checked for basically discs and kind of all the scary stuff. We'll basically just kind of make sure everything's even. It's just like very, very slightly off, and then you have some tension in there, so we'll kind of take that out, and then we'll see how you feel. It'll be mainly just a feedback thing for me as far as frequency, intensity, duration of those things to kind of think of. So first thing, and it's something that I'm just looking at.
Sure.
It's just very, very slightly on that left side. You have a little bit more quad tension
Okay.
and a little bit more tightness that I noticed. So I'm gonna hang out in this spot. Are you doing okay with that pressure there? Cool. And your spot is a little bit higher up from here, correct? Cool. We'll get into that hip a little bit right now with some soft tissue before we get into the adjustments. Are you doing okay with that pressure right here?
Mm-hmm.
Okay. We're gonna do a little bit of traction, so the table's gonna come down like that. And are you doing okay
That's great.
on the pressure there? I always find it with my lifting athletes. You know, you're creating so much compression that this is.
Oh yeah, this is everything.
Yeah, I used to get this at least once or twice a week at my old office when there were other chiropractors.
And are you sliding your hand up to try to stretch that muscle fascia as well too?
Yeah, basically blocking the vertebrae, and then
Okay.
as your body comes down, we're just getting a little bit of that flexion to create that decompression. I do have a separate decompression table upstairs,
Okay.
and I'll use that for more specific stuff with like disc injuries, and
Yeah.
it's a little bit longer of a treatment.
Is it like a Triton table type deal?
Yeah, exactly.
I've used this before.
Cool. Yeah, I'll show you around after the appointment so you can see all that stuff.
Me too.
But I usually try to start everything manual, and if you respond really well with that, then we just stick with that because then I can feel your body and your improvement a little bit easier. Alright, let's go ahead. I'm going to have you come onto your side and face me over here. Sure. You've already got the setup there,
Oh,
so
yeah.
we're just going to take this leg here. I'm going to scoot you this way. Good. And we'll just grab on right here. So when I take the hip in that position, any pinching at all there?
A little bit of tension, nothing too crazy. Just feels like a good glute stretch.
Okay, awesome. So a little push. Good. And then one more. Great. Let's go ahead and face that way.
Cool.
It's been a little bit since you had an adjustment.
Yeah, it's probably been a good 3 months.
Awesome. So that felt pretty good. We got into that SI a little bit, and I'm just gonna have you hold right there. Good. Awesome. One more up here. Great. And let's go ahead and sit up facing this way. So we're gonna get directly into that spot with this adjustment. Sweet. So we're gonna take the hands like this, and we're gonna take it back behind the head as low as you can on the neck. Perfect. And then if we take the elbows in, a big slouch forward. Does that feel okay there?
Mm-hmm.
Okay. So nice and relaxed. We're just gonna fall on back through here. Oh man.
That was awesome.
That was
Good.
That was that spot.
Yeah, I would say so.
a little bit of tension in there.
Yeah. That felt great.
Good. Well, I'm excited to recheck some of those ranges afterwards.
Yeah,
and
me
see
too.
how that feels. Cool. And while we're in here, neck's feeling pretty good.
Neck's feeling great. A little tension in the suboccipitals, but nothing too crazy.
Okay. And that tension in the suboccipitals, that's kind of normal for you?
Yeah, it feels pretty standard. Nothing too crazy.
Okay. No headaches or anything with that?
Nope.
We'll hang out in those spots. You doing okay with
Uh-huh.
that pressure there?
Yes, sir.
And so you used to work at a chiropractic office?
I did, yep. And I worked at the front desk there for a bit, and I kind of worked my way into the exercise physiologist role there.
And then now that
And
brought you into NeuAbility.
Now I'm here, yep, you betcha. Just a way to help more people.
Yeah, you guys are like my favorite connection. It's definitely made me learn quite a bit.
It's a pretty cool process, man. And I just took over the internship coordinator position too, so now I get to recruit all the new interns,
Oh, cool.
which is pretty great.
And is that a lot of physical therapy students?
Yeah, dude. Well, I shouldn't say it's PT students. It's all would that be undergrad, kinesiology, exercise, health and exercise science, things like that. We get a bunch of pre-meds too from Boulder,
Okay.
which are always, it's interesting to work with those guys.
Yeah. Yeah,
they're
because
just-
one's physical medicine, one's...
Mhm. Yeah, more of that prescription based too, where I'm like, if you're working with me, I'm going to teach you how to be as handsy as possible here too, 'cause that's what I want to see in the medical profession.
Well, and I have a few like ER docs that are my patients, and that's one of the things that they have talked about is, you know, they wish that they knew how to do just certain adjustments,
Yeah.
especially like rib adjustments, because they'll have people come in to the ER and it's not really, you know, an emergency room situation. It's just they need a rib adjustment, and
Yep.
their licensing actually allows them to do that.
Oh, does it?
Yeah, which is kind of
Nice.
strange. All right, so we're gonna do a little push right here.
Nice.
All right.
Ooh.
And come down a little bit further. Are you doing okay with that?
Yeah, that was great, man.
That was deep.
Yeah, that felt fantastic. I needed that one.
Does that feel a little bit more open to you?
Yeah, it definitely does. Less tension and everything too.
You just have kind of generalized tightness through this whole TL.
Mhm.
So I'm gonna do some Graston. Have you had like scraping done
Oh yeah,
before?
you might see some cupping mark down there.
Okay, cool.
My parents gave me a cupping set not too long ago, so I was messing around with that at home the other day.
I used to have one of those in the office, but I never ended up using it.
Yeah.
There's a stretch therapist that works with me here, and she does more of that stuff. So
Nice. There you go.
it's nice to be able to split up that work. Yeah, great. And is it tender at all into those spots, skin wise?
Skin wise, no, it's all fine.
Okay, so just super, super gentle. I just want kind of a generalized release through that area.
Okay, cool.
Doing okay on that pressure so far?
Great already.
Good. Yeah, that adjustment was what you needed.
Yeah, I would completely agree with that. Yeah, the meeting, it's always interesting because the chiropractors that train me on, they're very similar to yourself.
Okay.
They're young, they're athletic, they do all the different stuff that keeps them healthy too. So it's it's the idea of what I want to go to a person that does the stuff that I do to help keep themselves healthy too.
Totally.
So like I'm meaning to get an appointment down there. Since I was watching your videos last night, it's like shit. This is exactly what I'm looking for, and you're right next door too. So
Nice.
damn well for me.
Yeah, I mean, that's what I always kind of recommend when somebody is looking for a chiropractor is just find, the youngest person that you can because you're a little bit closer out of school,
Exactly.
a little bit more up to date on the research.
And not to mention too, you have, generally speaking, you have more time to emphasize where things to go to,
Totally.
and like you want to really serve them quite a bit too, which is awesome.
You want to do what?
Really serve them too, really help fix their issues.
Yeah, there's a little bit more passion.
Yeah. The chiropractor that I worked with, it was her first job directly out of chiropractic school too.
Okay.
And she was like,
Sweet.
she was like just head over heels for everything that you could possibly do.
Yeah.
It was great. It was awesome. I learned so much from her.
Good.
And the rest of the team there too was awesome.
Yeah, that's the goal. If you can just create a team like that, so glad to have you guys next door. So, go ahead and rotate through that spot. See if that feels a little bit more open.
Oh yeah, definitely feels more open.
Okay.
Yeah, I would say so.
Great.
It feels better.
The subscribe button is right here. Make sure to hit that. I'll be putting up some really cool videos in the next few weeks.
Perfect.